Are you obese? If you are, there is a high chance that you would have diabetes, heart conditions, high blood pressure, and periodontal diseases. Yes, you heard that right, periodontal diseases. Periodontal diseases are conditions affecting the supporting tissues of the teeth. This often starts with gingivitis, which is gum inflammation. If untreated, gingivitis progresses to periodontitis, which is characterized by bone loss around the teeth. Recent studies have shown that obesity and periodontal disease often go hand in hand. As a person's body weight increases, so does progression of the disease. Despite this, nobody knows how one causes the other. This study shows that insulin resistance connects obesity and periodontal disease. Insulin is one of the many signaling molecules secreted by the pancreas that induces a cascade of messenger molecules to elicit a response in a human cell. One of the responses is regulating inflammation. Insulin resistance results when the action of insulin on its target cells is inhibited. In this experiment, fat and lean rats were euthanized, had their lower jaws removed, gums blended to a paste to extract the messenger molecules using immunoprecipitation and immunoblotting, and finally the amount of bone loss was recorded. It was shown that fat rats had significantly higher levels of glucose, fats, insulin, and cytokines in their blood. Immunoprecipitation and immunoblotting revealed normal levels of insulin-induced messenger molecules in lean rats, while fat rats were deficient in those messenger molecules. In contrast, fat rats had much higher levels of fat-activated messenger molecules such as PKC, which interferes with insulin messengers resulting in insulin resistance. The experiment was repeated using genetically modified mice to investigate the activity levels of nuclear factor kappa B using a technique called CD31 immunofluorescence staining. Nuclear factor kappa B is a protein complex that increases production of inflammatory signaling molecules. An increase in nuclear factor kappa B would increase the recruitment of inflammatory cells, hence an increase in inflammation. Significantly higher levels of nuclear factor kappa B was found in mice on a high-fat diet, as shown by increased fluorescence in the tissues, but this was barely observed in mice on a normal diet. Simply put, a significantly higher degree of inflammation was observed in mice on a high-fat diet. The results of both experiments explain how obesity causes periodontal disease. Obesity results in high blood fat levels, which activates PKC. PKC interferes with insulin-mediated pathways, resulting in insulin resistance. PKC through other pathways activates nuclear factor kappa B, which increases the production of cytokines. Cytokines recruit inflammatory cells, resulting in gingivitis. Periodontitis, which results in bone resorption, does not occur because of the absence of periodontal pathogens, such as P. gingivalis. Current therapies to treat periodontal disease include cleaning of teeth, lifestyle changes, and surgery. This research provides an insight into how diet and lifestyle influence the progression of periodontal disease, including the use of antioxidants. Examples of antioxidants include vitamins A, C, and E that can prevent the interference of PKC in insulin-mediated pathways. This would reverse the downstream effects of fat-mediated insulin resistance, such as increased inflammation and impaired tissue recovery. Antioxidants also has anti-cancer and immune-boosting properties. However, it has been shown to increase the risk for lung cancer in smokers. This study has proven that a causal relationship exists between obesity and periodontal disease, but being the first of its kind, more studies are required to validate the results. While it is well known amongst dentists that positive changes to lifestyle can have beneficial effects on oral health, advice such as exercising and weight loss are not commonly offered to patients. This study may provide an impetus to dentists to include and push for lifestyle changes in dental advice and perhaps to include monitoring of body weight and blood tests in patients' clinical profile.